Imagine feeling completely normal and then suddenly getting a sharp pain in your chest and struggling to breathe. Most people will assume it's a heart attack, but sometimes the real cause is something most people never think about: a blood clot. A few years ago, a patient suddenly developed chest pain and shortness of breath after a blood clot traveled into her lungs. This is called a pulmonary embolism, and it can become deadly very quickly if treatment doesn't happen fast enough. Normally, blood clots are actually a good thing. If you cut yourself, your body creates a clot to stop the bleeding. Without that ability, even small injuries could become dangerous. But problems start when clots form inside blood vessels when they're not supposed to. Some clots stay in one place, while others break loose and travel through the bloodstream. And once a clot starts moving, it can suddenly block blood flow somewhere else in the body. Blood clots can happen in both arteries and veins. Clots in arteries are especially dangerous because arteries carry oxygen-rich blood to important organs. If a clot blocks blood flow to the brain, it can cause a stroke. If it blocks blood flow to the heart, it can cause a heart attack. But clots in veins work differently. These clots usually form in the legs or pelvis, and they can sometimes grow surprisingly large before a person even notices them. Some people develop swelling, pain, redness, or warmth in the leg. Others have no symptoms at all. In the patient's case, there was no warning signs before part of the clot suddenly broke off and started traveling through her body. The clot moved through larger veins, passed through the heart, and eventually became stuck inside the lungs. This blocked normal blood flow and made it much harder for the body to get oxygen. Very quickly, the patient developed chest pain, shortness of breath, and a racing heart. In severe cases, this can lead to collapse or even death within minutes. Thankfully, she made it to the hospital in time. Doctors gave her blood thinners, which helps stop new clots from forming while the body slowly breaks down the clot on its own. They also placed a small filter inside a major vein to catch any further clots before they could reach the lungs. Fortunately, she recovered fully, but her case also revealed something important. Blood clots often happen because blood flow slows down for too long. Before developing the clot, the patient had recently undergone major surgery and spent a lot of time recovering in bed. Long periods of sitting or laying down make it easier for blood to pool and clot. This is why long flights, smoking, obesity, pregnancy, certain medications, and even dehydration can increase the risk. And while blood clots can sometimes happen without warning, staying active, moving during trips, and paying attention to sudden symptoms like chest pain or shortness of breath can sometimes save your life, because in many cases the most dangerous blood clot is the one you never knew was there.